Later today, elderly Hungarian Vizsla Bella is heading in to see Scott. But first, she's enjoying a quick play with her owner Darcy and children Piper and Tate.
Good girl.
Yes.
Drop it. She's like a 14-year-old toddler, really. She still behaves like a puppy when people arrive, jumping and barking. Oh, so close.
Recently, Scott made an alarming discovery.
He found a potentially cancerous lump on her back, which grew quite quickly.
Scott sent a sample of the lump for analysis, and the results confirmed his fears that it is a potentially dangerous tumour. The news came as a shock to Darcy and the family.
Bella is such an important part of our family. You know, she sleeps in our bed with us. And the kids absolutely adore her.
You're gonna get a wet face, you know.
Tate is one brave boy letting her lick his face like that, given what her breath smells like.
Oh.
She also has had some problems with her teeth. That's causing her a lot of discomfort. So hopefully Scott's gonna take care of her teeth. She'll have no pain in her mouth, excellent breath, which we're all looking forward to. And this lump will be removed so that we can have her with us as long as possible. Okay, you're gonna be a strong granny today, right?
Yes.
And you're in great hands with Dr. Scott. I think general anesthetic is always a worry regardless of age, but given how old she is, that's my main concern. I can't imagine this house without her in it. She's my first baby. You're a big, strong girl.
Mudshoot's a working farm with plenty of animals to keep a vet busy, and today I have been asked to ultrasound some pigs, some Tamworth sows. It's hopeful that they're pregnant, so fingers crossed Farmer Tom will hear the pitter-patter of tiny trotters soon. Hey Tom, how's it going?
How you doing, all right?
Yeah, very well, thanks.
Good to see you.
And you. So are these the potentially pregnant porcine, are they?
Hopefully so, yeah. These are our two Tamworth sows, Margot and Mary.
All right, well, to ultrasound them, I'm going to have to get in there. Are they lovely, friendly pigs?
They are very well-mannered pigs, yeah.
Yeah.
That's very important for us here.
Yeah, it's not very good if they then eat the guests.
No.
So-
We've got some
some encouragement.
temptation here.
Okay.
It doesn't look very appetising to us, but that's like pig caviar, really.
All right, okay. Mary, Margot, you going to be good for the vets?
Yes. If both the girls are pregnant, it would be fantastic because we haven't had piglets here for nearly 7 years. And it will mean that we've got a fully functioning breeding herd of Tamworth pigs. Now, these pigs, there's only 200 to 300 registered females left in the UK. And if a little place like us in the middle of London can put piglets out in the breeding populations, that's fantastic.
Come around this way.
Here, pigs.
Come on. That's it. It's a lot different when you have kids yourself. I don't remember doing it in a farmyard with a bucket of food being given to my wife.
No.
All right, let's see what she's going to do. Ultrasounding a pig is, not surprisingly probably, quite difficult. In a vet practice, the largest animal you might have is a Great Dane. Well, these pigs are probably 3 times the size of a Great Dane, and finding the piglets within a large animal is very difficult. Good girl, I know. Oh. There we go. What I can see down here is just what looks like 2 little trotters having a swim. Can you see that?
Yep.
That's a leg. So this girl's definitely pregnant.
That's marvellous news. Absolutely brilliant.
So far, so good. Mary is definitely pregnant, and hopefully the same will apply for Margot. So there's one there. So, Tom, very exciting news. This one's also pregnant. So
That's brilliant. That's it. Well, it's good news that both of them are in pig.
Yeah.
Because it means we've then now got a breeding herd of Tamworth pigs, which is marvellous.
So she's a little bit less along than the other one. I think she's probably going to have a few more weeks on the other one.
It's fantastic news. Both of them are pregnant. One is a little bit more forward than the other, so it gives us a bit of leeway between them giving birth, which is fantastic, you know. Lots of little trotters pattering around the farm, getting into mischief and causing trouble. So, Scott, just before you go, I just wondered if you'd have a look at some rams for us.
Okay.
Getting ready to go to the Royal Berkshire show.
Yeah, sure. Well, from pregnant pigs to sheep on show, why not? Hi, how you going? I'm Scott.
I'm
Nice
Reece.
to meet you.
I'm Reece.
How you going? And who's this strapping chap here?
His name's called Tree Hill Cameron.
Tree Hill Cameron?
Yeah.
Very posh. So, hello, mate. Very, very handsome boy you are, aren't you? Hey? Now, I notice there's another chap over here.
Yeah.
So, what's this guy's name?
This one's called Steve.
This one's got
Two
the
names.
Tree Hill Cameron.
Yeah.
That's a Steve.
Yeah, that's
there
a
he
Steve.
is.
Reece is one of the Mudchute farmers, and he's hoping his rams are in tip-top condition, ready to compete at the Royal Berkshire Show next week.
I just want to give him a health check, just a check over, make sure he's all good.
Yeah, oh, he's looking amazing.
Yeah.
These two rams are about to take quite a long journey from the centre of London, East London, all the way out to Berkshire. So it's really important that a vet checks them over first to make sure that they are fit to travel. So the most important thing, I think, for travel is to check his legs and feet and to make sure that he's able to withstand the journey. So I'm just going to have a little look at you, mate.
Tree Hill Cameron is a rare breed of ram called a white-faced woodland.
That's looking pretty good.
Yeah.
All right, yeah, I'll just swap sides with you.
While Mudchute is all about saving animals in need, it's also been the saviour of some of the workers who care for the animals.
So what was your history with getting into the farm?
Oh, well, basically, I was causing a lot of trouble around my area. And I used to, knock down ginger, throw stones at windows and do basically stuff what shouldn't be done. Yes. And there was my local farm back where I live in Vauxhall, called Vauxhall City Farm. So I was helping out there, volunteering.
Yeah.
And then that's when I got into animals.
Right.
Basically from there. I ain't looked back since.
So animals change your life, eh?
Yes, they did.
Yeah?
Hell of a lot. If it weren't for farming now, I think probably be in prison by now. Just causing a lot of trouble. I would have been in prison by now. But it's changed my life completely, so it means a lot to me.
A reformed Reece now has his heart set on a win at the show.
Okay, Cameron, be a good boy. Wow. Of course, for me as a vet, I need to assess the ram to make sure that he's healthy. But also, it's quite interesting to check the features of the ram that the judge will be looking for in the show ring, such as how impressive his manhood is. Besides being gigantic. They both feel of a similar size. There isn't any lumps or bumps.
Good.
They feel perfect.
Yeah?
Well, I'm really happy with his health. He's an impressive specimen. So I think he's more than healthy to travel to the fair, so...
Oh, that's really good.
Yeah.
Yeah.
All right. Should we tie this guy
Yes.
up and we'll have a quick look at Steve then? All right, Steve. How's it going, mate? Eh? For the next ram I'm about to look at, his name's Steve. Just Steve. He's a great-looking boy, isn't he?
Yeah, this is my favourite ram.
Yeah?
Yeah.
Let's have a little look at you, mate. Oh, I can see the problem back here. I noticed that he has a little bit of discharge at his back end. Reece informs me that he has had some scours, which is basically sheep diarrhea. Have you fed him anything different, anything that he might have got hold of that might be toxic? Or?
No, it's just obviously he's out on the grass.
Steve's scours could be caused by lots of different things. It could be parasites, it could be something toxic that he's eaten, but because he's recently been treated for parasites and he's not unwell, my guess is he's just been eating quite a lot of wet pasture. Well, I mean, he seems very healthy otherwise, so let's just hope that the hay binds him up. My treatment plan for Steve is basically just to dry this boy up. We're going to be giving him a lot of dry food in the form of hay only. Hopefully that will just solidify the diarrhea back to normal poos in time for him to travel to the show. Let's get him on the road to glory.
Yeah, hopefully.
Yeah.
Show him what you're made of, Bella. All right? A big, strong, old girl.
At the Richmond Practice, Scott's now back from Mudchute Farm, and Darcy has arrived with 14-year-old Bella.
She's so shaky and nervous, poor thing.
Good morning, Darcy.
Morning.
Hi, Bella. Well, I don't think I've ever had a more nervous-looking pair.
I know.
At the
We're
practice.
both quite nervous.
Yes. Look at you, you're gorgeous old dear. Hey, what are you quivering for? She thinks she might have heard what might be up today.
I think so.
All right, sweetie. Well, do you want to come and see me?
Come on, Bella.
Come on. Darcy's brought beautiful Bella into the practice today because we are considering an anaesthetic and surgery. Obviously, it's a very nerve-wracking decision, so we have laboured over it, being that Bella is the grand old age of 14 and a half. So, I can see very clearly that those teeth are looking pretty grim in there, aren't they, sweetie? Eh? We've tried to avoid, well, you licking my face because your breast's so disgusting, isn't it? But also an anaesthetic to try and sort them out because of her age. But I think it's something that we need to address.
Yeah.
And then alongside that, other lumps and bumps that we've got, particularly this one back here. So that's a fairly significant lump. Do you feel that that's grown even in recent days?
Possibly. It also might be a bit harder as well.
The lump that's growing on Bella's back, I'm quite concerned about. When I saw it recently, it was much smaller, much softer, and in the space of just a few days and weeks, it's become much larger and harder. Well, the sample that we did came up with something called spindle cells, and they can be associated with some not very nice types of tumours. If this spindle cell tumour turns out to be graded as a fibrosarcoma, that's really bad news. They're very malignant. They spread locally, but also can spread to other parts of the body. So it does make me quite worried about Bella's future. That is a decent-sized lump as it is, and to remove it, we're going to have quite a large margin to remove it completely. And then alongside that, I feel like it would be remiss of me not to approach the mouth, even though it's not ideal, because we like to tend to do sterile and non-sterile surgeries separately, but we just don't have that privilege with her because she's an old girl. The anaesthetic is more risky than anything else, and that's the bit that we're concerned about, and that's why together we just haven't gone down that road. But she is strong and she's healthy, and it feels like we're at crunch time. Do you feel the same?
I do. And the longer we can have her with us, the better. So if this is going to make her quality of life better, I think that's what we need to do. Okay. Be a good, strong girl for me, okay? All right? Everybody's going to be waiting for you at home, all right? You be a good girl. It's very hard to leave her. She's my baby, but I know that Scott's going to absolutely look after her. I'm just going to be waiting next to my phone for the call when she's out of surgery and safe. Okay, bye, Grandma. See you later. You're in good hands with Dr. Scott. I know it. Okay, I'm going now.
Bye, Darcy. Bye.
Come on.
Go on in.
Boy. Come on. What's this? Come on. What's this?
In a nearby park in Richmond, another one of Scott's patients,
Come on, little
5-month-old Vince, is struggling to enjoy playtime with his owners.
Come on. Good boy. Come on.
Vince is Karina and Gaz's first pet, but they're extremely worried.
Come on. Good boy.
The little French bulldog isn't thriving or behaving like an energetic young pup.
Vince doesn't have those puppy-like mannerisms. He's very, very lethargic.
Come on. What's this?
We struggle to take him out for walks, and he's
like a little old man, really.
He means the absolute world. And people say that when you don't have a dog, they say, your life will change, and it's that unconditional love. You've had this little puppy for 5 months. Out of my whole life, just 5 months. Nobody can explain to you how much you love your dog until you actually have one.
It's part of the family, isn't he?
Yeah.
Karina and Gaz are so concerned about Vince's lethargic behaviour, they've booked him in for an appointment with Scott.
It's like our number one priority at the moment, to get him better and...
Yeah. So we think it's time to go and sort the little man out. Can't imagine life without him, can we?
No, not at all.
Such a quivery girl, aren't you? Oh, dear.
You don't need to worry, little one.
She's so sweet.
It's time for elderly Bella's surgery.
No, she's so scared.
and Scott has assembled a full team to assist, including vet Phoebe and nurses Reagan and Nathan.
Okay, so team, bit of a nervous one for us all today. We all know Bella, an anaesthetic on a dog of this age is not something we do lightly, is it? So we just need to make sure that we have kind of thought through all the possible complications, okay, make sure that we're all of one mind and we get the outcome, which is that she wakes up from the anaesthetic absolutely fine with gleaming white teeth and no longer any lump on her back, all right? It really is a catch-22 with Bella today because I found and am concerned about the possibility of her having cancer, but to remove the cancer means that I need to potentially put her life at risk. Okay, so everyone ready?
Yeah.
Deep breaths, everyone, especially you. Consistent breathing, heart beating, good girl. Heartbeat okay?
Yeah, heart's fine.
After a few minutes, we can see that Bella's breathing is fairly regular and her colour is good. It is the moment when we can start feeling a bit more confident about things and we can move forward with the procedures. I'm just going to take this little one off as well. Just let's not leave anything to chance. There's another little tumour which I'm not so worried about, but at the same time I think, you know what, let's not leave any questions or any stones unturned. Okay, everyone happy? Mm-hmm. You all right, Nathan?
Yeah, everything's fine.
Removing this tumour, we need to take quite large margins because certain types of malignant tumours will spread into the surrounding areas. So to get this tumour out completely, I need to take a 3 centimetre margin all the way around. So what seems like a quite small lump ends up being quite a large hole that we need to make. It's pretty deep. There we have it.
There we go.
So we'll have a look at it later, but it's right in there. Is that lump? You can see it moving around in there.
Yeah.
Okay, I'm just going to move northwards.
Scott wants Bella under anaesthetic for as short a time as possible, so he moves quickly onto the second, smaller lump.
Yeah, see, that's a very different animal. That's very superficial. You can see it's just underneath the skin, so it's quite a bit different to the other one. Okay, so we'll send it off as well, just to make sure.
Yeah.
It still could be just the early stages, so definitely worth taking out.
Yeah.
A lot of the time when you're performing surgery, you're so focused on what you're doing that the time can fly. In Bella's case, I feel like I have this internal clock just ticking and ticking and ticking. So as soon as I've finished with removing the lumps, it's straight out into the prep room to tackle Bella's horrendous mouth. Wow, they're grim, look at that.
There's not much tooth surface, is there?
That's not covered in brown grossness. Yuck. What I'm doing today is a little bit unorthodox. If Bella was a much younger dog, then I'd definitely be doing her teeth as a separate surgery to minimise the chances of cross-infection. But Bella's an old girl, she can't cope with that many anaesthetics, so we just need to do it all on the same day. The tartar around them is awful.
Are you glad you're wearing gloves?
Yeah, just wish I didn't have a sense of smell. Her mouth is basically the worst, dirtiest toilet bowl you've ever seen. It's full of bacteria, and she's consuming mouthfuls and mouthfuls of that every single day. So doing her teeth means that the bacteria goes away and Bella will be a much healthier dog afterwards. I can just see a little pocket of infection behind this tooth. The good news is, though, that it doesn't actually seem to be any cracks in the teeth. So I'm hoping it might just be a case of if I remove all of that tartar and give it all a good flush and a clean, it might sort the problem out without having to remove major teeth, which is very good.
But Bella's teeth are so bad, it's a painstaking process to clean them. And the elderly dog has now been under anaesthetic for around 2 hours.
Nath, how's the anaesthetic going?
Surprisingly really well, but I don't want to speak too soon.
Fair enough, fair enough. That's it. So her breath is immediately better and removed 2 potentially cancerous lumps, so we've done well. So let's wake this girl up, shall we? This is a dangerous moment for a dog waking up because you're bringing them out of the maintenance of anaesthetic. So it's where the heart and the lungs need to change, and there's lots of physiological changes associated with being woken up. And sometimes that can react badly with the anaesthetic and you can have issues. You've still got the adrenaline in your pocket, haven't you?
Yeah.
Come on then. Bella. Bella. Heart rate's raising now, so. I'm just listening to Bella's heart just to make sure that it's beating strongly, and now I can hear it starting to speed up. So that means she's starting to find some consciousness and we can both relax. As I hear Bella's heart rate speed up, I'm pleasantly assured that things are going well, and she starts to recover really quite quickly for an old girl. She seems pretty happy, and I'm very relieved. There you go. Look at that. Yeah, but that mouth feels nice.
Bella will sleep off the anaesthetic before going home later today.
Well done. All right, you sleep it off. Yeah? Call your mummy.
Come on, mate.
Little cutie.
In Hatfield, north of London, little 5-month-old Vince is so unwell that Scott has referred him directly to the Royal Veterinary College for testing.
Not too sure at the moment kind of what's going on.
It'll be fine.
We're really worried, but hopefully we'll be able to get to the bottom of it today.
Hi, I'm Rebecca.
Nice to meet you.
Nice to meet you.
Nice to meet you.
Nice to meet you, Karina. And this must be Vince. Say hello. Hello.
Dr. Rebecca Geddes will be investigating Vince's case.
Hello. Should we go through to a consult room?
Come on in.
What is your main concern about Vince at the moment? What's the reason that you've come here today?
I think it's probably his weight. Like, he's obviously very skinny at the back. He's not putting any weight on.
Yeah. It's also his temperament. Obviously he's only 5 months, so he doesn't have that kind of excitable energy that most puppies have. A lot of people have stopped us and asked if he's an older dog.
He sleeps a lot, like a hell of a lot.
When we see puppies like this who aren't growing normally, we sometimes call that failure to thrive. There are a lot of different possible reasons for that. Some of them are hormonal problems, and can be anything as varied as an internal organ that isn't working very well, through to being born with a problem where the metabolism doesn't work. So there's really a lot of possibilities on the table. Where I would suggest we start is with some blood tests, and then I think also doing some imaging would be a good idea. And then it'll be a case of putting all of those results together to decide where to move next with his investigation.
Perfect. Thank you.
If you just give it one little last hug for now, and I'll pop him through. Oh.
I want to get lipstick on you.
It's not darling. It'll be fine.
I think it's just the unknown of it is... I just wish I knew instantly
Yeah.
so that we could just make him all better.
Good boy. Well done, Vince. Good boy. You were so good. Well done. Just giving him some sedation. What we're going to do is essentially take a 3D X-ray of Vince. Pretty much going to do the whole of Vince, just to see if we can find anything that might be contributing to him not putting weight on very well.
So this is Vince's CT, and his tongue in here is really, really, really big.
Oh, okay.
So this is quite enlarged. And also his joints from his jaw, basically, they're angled in a very strange orientation. And then there's another little finding on the very back of the dog. So here in his muscles, in the thigh, very back, there's some area that is a little bit mineralized. And there may also be muscle that is affected. So he probably has something wrong with his musculature, but in general, not just in his head, but throughout the whole body.
So we've got thickening of the tongue and thickening of the diaphragm and some other muscle changes. So what we want to do next is investigate the muscles further by doing what we call an EMG, where we'll look at the electrical activity in the muscles. A normal muscle should just, at rest, be silent. We should have a nice flat line, but instead we're seeing a lot of kind of up and down, and you hear that really loud kind of aeroplane sound. That is completely abnormal and tells me that we've probably got a serious muscle problem going on. Hi, Karina, do you want to come through? So I've had Vince looked at by a number of different people. Neurology have been having a look at him, and we've got some blood test results and the results of the CT scan.
Yeah.
When we look through his body, there are some changes that we can find. So there's a muscle in his back leg that's got a little bit of mineralization, just a bit of a change in the muscle.
Yeah.
From his blood test, there's also something called CK that we can measure that is like an enzyme that comes from the muscle.
Right.
And his CK is really, really high. Normal is up to about 400. His is 37,000. So it's massively elevated, and that's another sign to me that his muscles aren't working as we would expect them to. It does make me worried that we might have something more like muscular dystrophy or something like that going on.
Right.
Something like that would be really quite a devastating diagnosis for him, because it may be something that we couldn't do anything about for him. Okay. Sorry. Yeah, I'm so sorry.
It's okay.
But this is something really uncommon, really rare.
Does that mean a shorter life? Most probably. Okay.
A much shorter life. Yeah.
Vince will be kept at the RVC overnight for further testing, and then Karina plans to visit Scott to discuss the final diagnosis.
We could be looking at a condition that will be life-limiting and that won't give Vince a good quality of life.
Hey, you've woken up very well, haven't you? Yeah? Ready to go home?
At the Richmond clinic, Bella has recovered from her anaesthetic, and a very relieved Scott is looking forward to reuniting the old dog with her family.
Go home soon? Yeah. Can see the kids. Yeah?
Upstairs, Mum Darcy, Piper and Tate are waiting to see the much-loved member of the family.
I've been missing her so much today.
I've been very worried, as a mom usually is, when their children are in surgery. I got the call around 2:30 that she was out of surgery and safe, and then my day was much better from there.
Come on. Who's this?
Hello, little girl. Oh, my word. Hello.
So it's very bright and happy considering, which is really, really great.
Girl.
Now you can see those big dressings, so what lies beneath might be a little bit shocking, okay? So you have to help Mum look after her, all right? It's fantastic to be able to discharge Bella back to her loving owners. She is a very old girl. It was a very risky anaesthetic. It was a major surgery, so it's a huge relief for me to be able to send her home. Let me just show you her new pearly white teeth.
Oh my word, look at those. Those do not look like a 14-year-old dog's teeth.
Look at that.
Those are amazing.
Yes. Hey, do you want to check her breath for me?
check her
You're the breath tester. Better?
Yeah.
Yeah? Doesn't
Good.
taste like garbage? Good. But obviously over the next few days, what we're waiting for is the results from the lab, from the lump. Okay. So that's the worry that's still out there. When we get the result, we'll obviously let you know. And hopefully, if it is cancer, we've got all of it.
Fingers crossed.
Exactly. Unfortunately, there is still quite a dark cloud hanging over the family until we get the results back from the lab to confirm what grade of malignancy these tumours are or if they've spread anywhere else.
Thank you, Scott, for looking after her.
Thank you so much.
Oh, you're very welcome. Hey, I think you're quite ready to go home, aren't you, my love? Hey, all right, well, you guys go. Give her lots of love, all right? And I'll be in touch when I've got the results.
Thank
All
you,
right.
Scott.
Bye, kids. See you later, monkey. Okay,
Come on,
remember
lady.
to brush those teeth, yours and the dog's, yeah? Bye, Darcy.
Thank you, Scott.
See ya. Bye.
Thank you.
A week after the visit to the RVC with her beloved pup Vince,
Hello.
Karina is back to see Scott. Sadly, tests confirmed Vince has an incurable muscle condition.
Scott's downstairs if you want to go straight down.
Vince is suffering with a condition akin to muscular dystrophy in people, which is basically where all of his muscles are wasting away. They are becoming mineralized, so they become hard, and they lose their function. So his tongue is solid, his swallowing muscles are weak, his muscles across his whole delicate frame are just wasting away in front of us. So it is not something that you want to find, and when you do, there's not much that we can do about it. To see that in a puppy that's 6 months old is heartbreaking. You know, our hearts are all broken for you guys because I just don't know how this must feel. You know, how are you guys going?
He's still our little man, so we just love him no matter what. We have seen a big difference. Very lethargic a lot of the time. Yeah.
It isn't normal, and he has lost his spark. This is just not a disease that we diagnose in dogs regularly. It's a highly irregular, very rare condition. And in all honesty, I've never seen it in the full 20 years that I've been a vet. A time will come where you and Gaz and I feel that he's not enjoying himself and his quality of life deteriorates.
Yeah.
And he deteriorates to a point where not being able to get up, not being able to enjoy your company, not being able to go to the toilet with dignity, you know, just not enjoying life.
Okay.
But unfortunately, it is going to be weeks, I think.
Okay. Okay.
No. He's just such a baby.
You little man.
So all we can do is just make him feel so loved.
Sadly, just days later, Vince lost his brave battle.
Vince was a heartbreaking case. To be diagnosed with muscular dystrophy, a wasting disease in such a young puppy. And, you know, Karina and Gaz are so brave and so wonderful, and, you know, you could see their hearts breaking and there's nothing you can do. So it's, yeah, just a really hard one to get over, really. Yeah, very difficult. One of the hardest in my career.
Sit. Stay. Stay.
A week after surgery to remove a large tumour from her back, elderly dog Bella is full of beans.
Good girl. Sit. Good girl.
It was terrible for the first 5 days. She literally couldn't sleep. She couldn't lay down.
Good girl.
But amazingly, she has come back to her active puppy-like self. I'm really thankful.
Yes, that's a good girl.
During surgery, Scott also carried out a much-needed teeth clean, and the old dog's breath has improved dramatically.
It smells better, doesn't it?
The licking used to smell like rotten potatoes and poo, so it was very disgusting.
You're next.
And now it smells like cream and fresh strawberries.
Have you had enough?
No. I like it.
Scott is now making a home visit to deliver the pathology results from the tumour.
Hey, Darcy.
Well, hello, Scott. How are you?
Good.
I hope you are the bearer of good news.
Yes, well, we need to go inside and chat about that. And the lady of the hour, hello, baby.
Say hello to Dr. Scott and thank you.
Well,
all right, follow me.
Let's keep the
Come on
thanks
in.
until we talk.
Yeah,
eh?
I guess that's true.
So first things first, the pathology results. So we knew that it was a tumour that we should be concerned about. That's why we went through the whole process. But thankfully, it's come back as a grade 1 sarcoma, okay, which is basically the lowest malignancy possible. So for Bella to have cancer, this is a good one to have because it's very unlikely to have spread. And although I had to take a lot of Bella away, I've got the result that I was after, which means complete cure.
That's amazing news. It makes me think that all of it was worth it because I have to say, Scott, when I picked her up and I saw it was under the bandages, I was a little worried.
Yep. Yeah.
But it makes it all worth it. I'm so thankful. Thank you for giving us more years with our sweet girl.
You're so welcome. It took a huge amount of bravery to put an old girl like her through this procedure, but we've done it, we've got the result we're looking for, and hopefully Bella will live a long way into the future. So how are you getting on with maintaining her beautiful, shiny white teeth?
Well, to be honest, I think we could use a bit of help.
Okay.
And I thought since you're here,
sure,
maybe you could give us some pointers.
More than happy. Hey, can we brush your teeth? All right, so if you just hold her there.
Come here, lady.
Just put a little bit on. Okay, so definitely a two-person job. The difficulty is just kind of holding your head, but once you've got a head in position, you just want to pressure from brush to the other hand. So brushing away, so top arcade and then bottom. Good.
She's doing really well for you. You're obviously better at this than I am.
Well, you know, a little bit of experience, just a bit. And luckily, it's chicken-flavoured toothpaste, so they tend to quite like it. It's a really great result. I'm really happy because not only have I fixed the top in that there's no more bacteria and smelly breath, but I fixed the back as well. So top and tail, perfect. Good smelling breath, hey? And a healed bottom. Yes, and a kiss. And a kiss that I don't even mind either. Hey? It's far better than before, missus. Oh, see, I won't say no to that kind of kiss now. That smells far better. Yes, it does. Yeah, yeah. Thank you, sweetheart. Good girl.
Over at Mudchute Farm, there's good news for one of Scott's expectant mums.
Is that all right? Is that good? Hey, is that good? What are them little piglets doing? Hey, little piglets.
2 strong, healthy piglets growing very fast is amazing. You know, this first time there's been piglets here at the farm for nearly 8 years, so it's a fantastic thing to have happen.
Little pig.
Yes, we would have liked more, but the fact that we've got 2 healthy piglets, a boy and a girl, is absolutely amazing. So these 2 Tamworth piglets are the start of our contribution to their conservation.
Look at you, lovely little piglets.
Good morning, everybody, and welcome to the 2017 Royal County of Berkshire Show.
And at the annual Royal County Berkshire Show, Scott has arrived for a final checkup on one of his patients.
Morning, Reese. How's it going?
Yeah. Thank you.
Good. Hello, Steve. How are you, mate? How's that runny bum of yours?
Reese has brought several of his rams and ewes from Mudchute Farm to compete at the show.
Reese has asked me to come along today to check over his sheep, particularly Steve, and make sure he's okay and ready for the ring. Hey, let me just have a look at your back end, my friend. See, oh yeah, that's much better, isn't it?
It's not as runny as it was.
And I can see there poo on the floor, much more formed, isn't it? So
yes.
That's good.
Yes, it's got a lot stronger.
Great, that all hay diet's done the trick, eh?
Yes, definitely.
Bound him up a little bit.
Yeah.
Steve's had a little bit of the runs and we wondered if maybe it was a little bit of nerves, but I actually think he probably was fed something a little bit different at the farm. Sometimes they have visitors that feed them things that they shouldn't. He's got a bit of an upset stomach, but now having an all hay diet has dried him up and he's ready to go. So obviously you are looking suited and booted, sir, ready to go for the big event.
Yes.
What is involved with sorting out this guy for the ring?
Basically what we're doing now is just giving his face a tidy up. Obviously we clear all the crust out of his eyes.
Yeah. now I've given Steve the all clear and he is perfectly healthy and ready for the ring, we need to get him show ready. So it does mean a little bit of ram personal grooming, which requires oiling of his face, giving him a brush down, basically making him look beautiful. All right, good luck, Reece.
Thank you very much.
Good luck. Watching Reece and Steve step out onto that stage, everyone's feeling quite nervous, but I'm sure they're going to go well. They've got such a great bond and they look fantastic.
Bit nervous. Always am though when it's our first show, so fingers crossed.
When I'm judging, I'm looking for a good structured sheep with a good straight back, stood on 4 legs, a nice head, in case of a ram, a strong head. The mouth needs to be good, the teeth need to be good. The wool's got to be a nice sort of texture to it, not too loose and fluffy. Obviously, the ram has got to have 2 decent testicles, matching, and basically how they walk, really.
Watching Reece and Steve from the sideline, I can see that the judge is eyeing them both up very well. There's some incredible animals in the ring.
Thank you very much, Mike. Bottom end of the ring.
And Reece and Steve do such a great job.
Thank you very much. Thank you.
They get a 3rd place, which is just an amazing result for them. Well done.
Yeah.
Nicely done. Yes, 3rd. Good job, Steve. Hey? They loved your work. Well done, mate. Very good. Oh, that's awesome. Good effort.
Thank you. But me and Steve did really well today. We got a 3rd place, so we done quite well against big classes. So really proud of him. So they're all clean.
Yeah, looking good. Yeah, you happy?
Yeah, I'm happy. It was a good thing that Scotty did come today because I was short of hands, so I needed someone to show one of the ewes for me as well. Do you mind helping me take one in and show one?
Yeah, I'd love to, but I have absolutely no idea what I'm doing.
Oh, I'll show you how it's done.
Okay.
Yeah.
All right. Okay, hopefully it's just as simple as grab a rope and walk.
Sort of.
Okay.
Sort of.
Great. Come on then, girls.
And turn it around. That's it. And just hold underneath the chin. That's it, like that, yeah.
It's quite nerve-wracking, actually, because, you know, this is a really important moment for all of these farmers. If the sheep place well, it increases the value of the flock, and that really helps the farmers. So, yeah, it is a very important moment for all of them. Come here, come on there. Sit. Yeah. I'll be honest, I've never shown a sheep before and didn't really know what to do. I walked the sheep like a bit of a lump, and I had to then push the legs in to be straight. I had to lift the head up. I had to sort of move around and then sort of look at the judge at the same time. It was very confusing. I didn't do a very good job. And I wasn't wearing the right clothing. No lab coat, felt naked. I think I've just come last.
At least I beat you. Thank you very much. Thank you. Cheers. Thank you.
So, my illustrious show ring career has ended with a last place. I don't think I've got a new career ahead. Yeah, and Reece beat me as well, which I'm really annoyed about. Right, let's steal it. Let's steal it. Okay. Right, run, run.
Scott's first job is 90 miles away. He's had an SOS from his good mate Charlotte on the Isle of Wight.
My friend Charlotte runs the Isle of Wight Zoo, where she looks after a vast array of exotic creatures, and one of her precious tigers needs help.
Scott will be joining a team of experts who've all been asked to travel to the island for specialist surgery on one of the resident tigers.
Were you having a snooze? Aisha, were you sleeping? Yes. Is she?
Scott will be meeting up with zoo director Charlotte, who spent most of her life caring for rescue animals like 19-year-old Aisha.
I came to the Isle of Wight when I was just 3 months old. I was brought here by my father, who thought it was a really good idea with a young family to buy a rundown zoo. Come and see Mum. I know. We got our first tiger when I was still very young, and some of them I have raised since they were very small, and a few of them are still here now, so that makes me feel very old. Good girl. I know, sweetie. I know. Oh, the good girl.
All tigers at the sanctuary have been rescued from circuses or zoos, and with Bengal tigers now an endangered species, Charlotte's efforts are part of a global push to preserve their dwindling numbers.
Humans have persecuted tigers and they've, robbed them of their habitat. And let's face it, we would all rather that they weren't here, that they weren't living a kind of life support system, and that they were living totally independently in the wild. That's where they should be. So it's never hung or sat very well with me, the fact that, they are living here and we are looking after them, but we do see ourselves as custodians of them.
Scott's already had experience working on Charlotte's big cats. After surgery last year on 21-year-old Zia.
We use just the same dyes that we would at the Richmond Practice with my feline patients. Put a little bit of dye in there, it stains onto her cornea, and I can see that there's a corneal ulcer.
Scott's back with us. He was really helpful when he came before. So, yes, I'm sure he's going to be a really instrumental part of the team. I know he's looking forward to it as well. Hi.
Hello, mate.
Hi, good to see you.
And you. How are you?
You've got cold ears.
Well, it's freezing every time I come to the Isle of Wight. It is bitterly cold.
But I think you're going to bring some Australian sunshine or something.
I think I've got some in my vet box, so don't worry. Despite Charlotte's warm welcome, I can tell she's nervous. These tigers, it's no exaggeration to say, are like her family, and like any protective mum, she'll do anything to look after them. All right, so this is Aisha's enclosure here, isn't it?
Yeah.
Hi, baby. Hi, Aishi. Hello, baby. Oh, hello. I've missed you too.
You saying hello to Scott? Are you saying hello to Scott? Yes, I know.
The greeting gesture for a tiger is a chuffing nose. It's sort of a reverberation through the nasal passages. It's kind of like purring for tigers. Yes, I know. It is absolutely incredible when out of the blue, this guttural chuff comes right back at you. It's literally like having a conversation with a tiger. Yes, hello, my baby.
You can't complain at that welcome, can you?
Although, she's got some pretty bad breath.
Yeah.
Hey, no surprises that she needs some dental work.
It's a good job she's a bit deaf as well. She wouldn't take kindly to you saying that.
I know. It's offensive. So, how has it come to your attention that she has issues with her teeth?
Just really by watching the way she eats, because normally they should quite comfortably be able to chew through hide and grind bone, and she's been very sensitive and reluctant to do that, to the point that we've had to cut her meat up for her like a baby.
Oh,
so she just gets
like
little
little
bits of
hors
fresh.
d'oeuvres.
I know, exactly.
Aisha's reluctance to eat really does tell me that she's in quite a lot of pain, and that rancid breath would definitely suggest that there's some sort of rotting teeth present in her mouth, and they're going to have to come out.
At 19 years old, she is, pretty much twice the age that a tiger would be living to in the wild. And of course, they weren't really designed in a way to live that long. And so their teeth, it's not unusual that their teeth would be giving them some problems at this age.
There's not many grannies out there that have got all their own teeth.
No, exactly.
In fairness to them, yeah.
Charlotte has arranged a specialist veterinary dentist to perform the extractions. And while Aisha's under anaesthetic, Scott will be in charge of carrying out a full health check on the geriatric tiger.
How are you feeling about yet another anaesthetic on one of your elderly tigers?
Yeah, it's just an emotional roller coaster, really. But yeah, we can't say, well, we're scared about the potential consequences of knocking her out and therefore we're not going to do it.
And she spends every day suffering.
Yeah, so no, we have to do it. And just with humans, anaesthesia gets more dangerous, obviously, as you get older. So, of course, there's always the worst case scenario, which is never far from your mind. It's always with trepidation. I never sleep well the night before. Gin and tonic always helps.
I know that we'll all do our very best to make sure
Yeah,
she
you
comes
certainly
through.
will.
We're going to sort you right out. Yes, we are.
While Aisha spends a quiet afternoon ahead of tomorrow's surgery, Scott now has 2 more unusual patients to attend to.
Hey, James.
Oh, yeah?
First things first.
Yes.
I hear I need to neuter some coates.
Yes, absolutely, yeah. These guys are my beloved ringtail coates.
Animal carer James is looking after 2 newly arrived rescue coates.
So this is Sattler. She's our female ringtail coati. She's very approachable, very friendly. And we've got Grant, the male, who's just hanging around behind us. Before Grant and Sattler came to us, they were actually doing children's parties. And what would happen is this gentleman would take the coatis on leashes and show the children. And once that party was done, then they'd get back in the crate and go back to this guy's basement.
God, it's just impossible to imagine. So glad that they're here.
Yeah, it was a little bit overwhelming from at first. It was a bit, gone from complete understimulation to overstimulation.
Yeah.
So it took them a while.
It's wonderful to see their sort of instinctive wild behaviours coming through.
Yes, absolutely, yeah.
But they're getting to sexual maturity, and that would be bad.
That would be bad, yes.
It's great meeting Grant and Sattler, but I am here for a reason, and that's to neuter them. First of all, it's because it's law here in the UK. These animals are invasive species, and if they accidentally were released or escaped, they can actually breed. And secondly, they're brother and sister, and you never want to have brother and sister mating, do you? Come on. Good boy.
Good boy, Grant.
Right, let's get out of this rain.
Yes.
This is my first coati spay and castration, but I am a vet with 20 years experience and I've neutered countless different types of mammals, so this is just another one to add to the list. Wow, it's absolutely beautiful day to neuter a coati, isn't it?
Yeah.
Hey? Isle of Wight.
Welcome to the sunny Isle of Wight.
Oh, it's absolutely glorious.
Yeah.
It will be the first ever coati neutering on the island, and Scott has been asked to lead the veterinary team.
Hello.
Hi, how you doing?
Wow, good. You really turned on this beautiful Isle of Wight weather.
Yeah, it's the Isle of Sunshine.
So here's our little coati patient.
Assisting Scott will be local vet Matt and nurse Francis.
Ready? 1, 2, 3, go. That's it. Okay. So Francis just about to cut. You happy?
Yep.
Yep. This is a procedure that any vet or nurse has done countless times and can pretty much do it with your eyes closed. And now you pop. That's it. I know I'm doing surgery on a coati, but looking at this, it just looks like I'm castrating a dog back in Richmond. So it's pretty cool. So that's the first testicle done. So now I'm just removing the right. Once I realised that this coati castration was very similar to a dog, I'm in efficiency mode, which means you get it done as quick as you can because you don't know what other patient's going to walk in the door any second. And that, my friends, is that. Okay, boy. We'll put him straight back in the box, eh? Thank you. That's it. Oh, he's already waking up. That's it. Good boy.
With Grant already starting to recover from his surgery, it's time for the spay on the female coati Sattler.
It does feel a little bit for me like a mechanic who is now working on a different model of car. It's still a car, it just has a few little differences. So I'm just going to use the same principles as I do in a dog. Yep. And hopefully that will be good. Okay, so now it's just the fishing expedition of trying to find a uterus of a coati. Hopefully it's hiding in here somewhere. It's interesting to see this on both sides. There's actually this ligament that's adhering it to the body wall, so it's actually making it difficult to exteriorize, so I have to cut through that. So definitely a little anatomical variation from a dog. It's really interesting, just the few tiny little quirks. Okay, so 2 ovaries and 2 horns there. Lately, I've been very lucky that I have managed to perform a number of surgeries on some exotic species. That's that. So we can wake this girl up. But now I can add coati, castration and spay to the list, so it feels like the members of the mammalian family in the UK should beware. Scotty's ready for you. Well done, team. 2 neutered coatis.
Excellent.
Happy with that. The doctor ordered. So now the culmination of all your hard work to train them to the point where they'll actually allow an anaesthesia without a gun.
Definitely, it takes a lot of hard work.
On the Isle of Wight, it's the day before surgery on elderly tiger Aisha, and Scott wants to check up on the unusual training she's been undergoing in preparation for the risky anaesthetic.
Last time I was here to perform surgery on a tiger, we needed to use a dart gun to deliver the anaesthetic. But this time round, Keeper Kaz has been doing some really interesting work with Aisha to try and reduce the stress of her anaesthetic.
If you imagine yourself, I'm running round after you with a giant gun wanting to shoot you in the bottom with a high-pressure dart.
Yeah. I hate when you do that, Kaz.
I know. But then afterwards, you're not going to want to be anywhere near me, are you? Good girl. When you're doing training, it's all very, very positive. It's a very cooperative relationship. I ask the cat to do something. If they do it, they get a reward. Not only is the animal less stressed, but there's a lot less adrenaline, so we need to use less sedator to actually knock them down, which in the long run is a lot healthier for the animal as well. Aisha, come along. Come along. Down. Okay, go ahead.
So I'm sort of pinching like the little sting of a needle might feel
Yeah,
when
definitely.
we do the anaesthetic. And how long has this taken you to actually achieve?
I have been working on it for about 6 weeks.
Wow.
Aisha's a really intelligent character, bless her, so it doesn't take her long to actually understand what it is I want from her. Aisha doesn't know Scott very well, so that would have been quite a new experience for her, and I think she did absolutely fantastic. She did really, really well. Come along. Down.
It's amazing.
This is really, really positive. I'm really
You've done
excited
a fantastic job,
Thank
Kaz.
you. Thank you very much.
I'm chuffed for you, and she's chuffing at you.
Yes, she is.
Not only is doing this trial run an amazing example of the work that keepers put in with their charges, but also it's very clear that Aisha needs this dental work because even the treats that we're using, she's really struggling to eat them. So we definitely need to perform the dental on her tomorrow. I'm so glad that you're putting in this work because I think it makes our job easier. It means that the risk for the animal is so much less anaesthetic, and hopefully Charlotte, our boss, will be happy. Fingers crossed.
That's what I dream of.
Hey, you're right. Do you need some help?
Yes, they weigh a ton.
Oh my God, they're huge.
They are massive. Do you want to grab that?
Yeah, of course. Oh, wow.
Yeah, they're not light.
Back at Scott's Richmond Practice, Claire has arrived with 5 new puppies.
Real landmark day because they are having their first vaccinations and a microchip. So they'll be ready then to go off to their new home into the next stage of their life.
Just going to give her a bit of a hand, Claire.
Whoa.
There we go. There we go. That's quite a big puppy, that one.
The pups were born 8 weeks ago at home, with Scott helping an anxious Claire through the ordeal.
Oh, what? She just popped out another puppy.
Oh, she did? Wow. That was
I can't believe that just happened.
The Sealyham Terrier pups are booked in today with vet Phoebe.
Hi, Claire.
Hello.
How are you?
I'm all right. Okay.
I've been looking forward to this all day.
Yes, they are the cutest things you could imagine.
You take one end, I'll take the other. Oh, there we go.
I'm very excited, but also quite daunted. It's going to be mayhem. Look at that little face. All I want to do is cuddle Claire's adorable little puppies all day, but unfortunately we have a job to do.
There we go.
Hello, little black ear.
Little black ear.
Right then.
Okay.
Temperature time, the third meanest thing I'm going to do today.
Ooh. Ooh, it's going to be cold. You're a good girl.
No murmur.
Good. It's all new and exciting.
Good, good. Passed your health check.
Yay!
Yay! Now it's vaccine time.
Oh
no! She's barking at my feet. First one today.
Yes.
Look at that!
Did you do it?
Yeah, I've done
it. You didn't even notice.
She was really good. So the first thing is we have to scan to make sure that you don't have a microchip already.
Yes.
There we go. I can't find one.
No.
Unfortunately, this is the rather large needle that I have to use to inject the puppies' microchips. I hope it's not too scary for them because it's almost as big as them.
You good girl, you're so brave, you're so brave, you're so brave, you're so brave, good girl. It's okay, it's okay. Oh, it's okay.
They're all gonna hate me. On to the next one.
Big chunky puppy.
It's time to bring out my secret weapon, I think, which is treats. This will hopefully keep the puppies distracted at one end while I inject them in the other.
Oh, the power of a food distraction.
Well, now we know what to do with the others.
That was brilliant.
That's incredible.
Look at that.
Success, 2 down, 3 more to go. There we go.
Oh, a treat apparently makes it completely painless.
There we go.
That's it. You passed. Well done. Yeah, so brave. Oh,
there we go.
There we are. That's it, last one. Yay, there we go. There we go.
All done.
And everybody still loves you.
And everybody still loves me. That's a good sign. Hello. All finished. Hello.
While the pups recover from their first vet visit, Claire can start looking for their new homes.
How you feeling?
Yeah, a bit butterfly-ish.
Next morning on the Isle of Wight, it's time for 19-year-old tiger Aisha's surgery.
Kind of like to just fast forward, really, and get to the point where we're waking her up and everything's gone smoothly.
Charlotte has assembled a team of experts from around the UK to make sure everything goes smoothly for her elderly cat.
We've got John Lewis. He specialises in anaesthesia, big cats and also primates, but he works all over the world. He works out in the wild in Siberia, for example, with tigers there. So, yeah, he's the guy that you want in charge of the knockout, definitely. We've got Matthew Oxford, so he specialises in veterinary dentistry. Matthew Twitchett, who's our local vet who has overall care of the animals on a day-to-day basis. And, of course, we've got Scott, so she's got a good A-team around her.
Are we all ready?
Yep.
Okay, go for it. Yes. Aisha!
With the team in place, it's time for the crucial final part of Aisha's anaesthetic training.
Aisha? Down. Unhurry.
Aisha can't eat so close to surgery, so this time Kaz will be relying on just the sight and scent of the meat to guide the big cat into position so John can safely inject the anaesthetic.
Down.
Always tricky. She goes down, we might best just hand inject the rest of it. It just depends where she goes and how far she goes down. It's annoying. That is the problem with hand injecting, as opposed to darting.
So, John, all the training that Kaz has put in to encourage Aisha to accept a hand injection kind of half worked because you got half the drug in.
It's a bit like working with children, isn't it? I mean, sometimes they behave, sometimes they don't. I mean, cats, they're not machines, so they won't necessarily do everything you want them to do. Even after training, every time. I'm a stranger. So if nothing else, the one thing that's odd to her is me. Now, the fact that I'm doing something else, a little nip or whatever, is an additional oddity, so I'm not surprised. We'll see how sedate that makes her when she's had partial injection, and if she's close enough for me to just, you know, give her the rest of it, that's what we'll do. She has gone very dozy, and she's got her head right against the door we need to open. So I'm just going to open the door a little bit and then just give her the rest of it by hand injection, hopefully. But if she springs up when I'm doing that, I'm going to come out very rapidly. But I think for safety reasons, I'm afraid I'm going to ask you to step outside. I think you give her a minute.
On the Isle of Wight, it's a stalemate for Scott and the surgical team, with partially anaesthetised Aisha now wedged in an awkward position, blocking the door.
So if you could step outside. Do you know, I'm not going to give her the whole lot.
What John's done then is shown all of his experience, because he's just had to go in and further inject Aisha as she hasn't had the full dose. He's done that really at his own peril. Very brave man.
Well done, John. Okay, well, she's fast asleep, actually.
It's really tense today. You can absolutely cut the atmosphere with a knife.
Go on. Well, let her stop twitching, I think. Then we'll move her.
John, is that okay to come in?
Yeah. Hang on, everybody, just hang on.
One,
Come on,
two,
let's get on with
three.
it. That's it.
Poor Charlotte looks so nervous and so worried. But all the professionals here today are a little bit nervous, as you would be when you're anaesthetising a 19-year-old tiger.
Time is now critical. Aisha can't stay under for more than 3 hours.
So now it's all systems go. While Matt is looking at Aisha's teeth, I've got a list of problems that Charlotte wants me to look at. So just clipping Aisha's leg, we're just going to put in a IV catheter just to have IV access, but also so we can take a sample of blood and just see how healthy this girl is. She's an old girl, she's 19, so we just need to check her liver and kidney health, particularly her kidney health. Just like a domestic cat, their kidneys do start becoming a little bit dysfunctional as they get older.
While Scott and Matt quickly get to work, John is closely monitoring Aisha's erratic breathing.
She's a strange breather. She seems to forget about breathing from time to time. It's very odd.
Are you happy with me to start taking teeth out?
Oh, yeah.
Yep.
I can crack on with it.
It's just assessing this right fore, which is the one that this tiger's been quite painful on. She's definitely lame, but I can't see that any of those nails are growing in to the pads. So that's not the cause for her lameness, so it's more likely to be arthritic change, which wouldn't be a surprise in an older girl like this.
It is very useful where we've got work going on, you know, obviously in a mouth, that there's somebody else on hand who can then be doing these other things. And again, it just cuts the time down. So Scott's got his to-do list, so he'd be ticking those items off.
Oh, ouch, look at that. So just having a look at the nails here, we can see she's like an old cat that has slightly overgrown nails. She's not walking the roughly she was before, and so they're gonna grow a little longer. So I'm just gonna trim them. Okay, ready? Yep. Okay, close your eyes. Okay. All right, so that's it. Job done.
Yep, they all look really good.
Good. Little grandma pedicure.
While Scott's getting through his list, the dental isn't going as smoothly. Matt has successfully removed the first 2 teeth, but the third won't budge.
We're not near yet. We've still got 2 roots on this tooth to take out. It's wobbling around so much in there.
I really feel for Matt. A tiger dental at age 19 is really difficult. They're huge teeth, and also because she's older, a lot of her teeth are actually welded to the bone. It's called ankylosis.
Nearly. It is so really, really close.
You do very well not to swear.
When it comes out, there'll be an almighty hallelujah. So close to coming out.
Can I help you? So we're just removing the lower molar on the left-hand side, and it's being a little tricky. So I'm just helping Matt wherever I can, but it's quite a struggle, and he is breaking into a sweat.
That's part of it. Make it easy, get the rest of it out there.
Oh, so you got some teeth out? Well done. Wow, that was bloody hard work.
We're in 2 hours 20.
Time is running out, but the team still has work to do on Aisha's other side.
Moving on to the forelimb of Aisha, I have a little feel of her wrist joint, the carpal joint, and also the elbow joint. Quite a lot of sort of nuts and bolts kind of grinding going on in her elbow, so oof, really clunks there on full extension, really clunks. So as a result, there's quite a bit of arthritic change within this joint, and it would absolutely explain why she's quite lame. She's just got elbow arthritis. Nah, she's an old girl that just needs some anti-inflammatories.
The last troublesome tooth is finally out.
Yeah, it was hard work, but the outcome is the main thing. How hard we have to work doesn't really matter. We just got to do the last bit of suturing, and then we can wake her up.
Okay, 1, 2, 3, go. It's been a long procedure, but a worthy one. We've managed to assess a lot of different issues, and now, fingers crossed, she wakes up.
An anxious Charlotte is sneaking a very quick look at her precious old girl.
So there you have it. 1 Tiger Dental done. So how are you feeling?
Relieved. Well, I'm smiling. Yeah, I'm massively relieved. We've done all the work that we needed to do. So it was a massive team effort. So looking forward to seeing her back properly up on her feet and chuffing in her normal Aisha style. So yeah, at the moment she's feeling groggy, feeling like she's got a bad hangover, but all the signs are really good.
You've got a full set of teeth, and your mummy is not supposed to be tolerant of you chewing. But apparently she's tolerant of everything and has infinite patience with you.
Back in Richmond, Claire has some exciting news.
No, don't chew my hands.
She's had success finding homes for her Sealyham Terrier pups.
That's better. You're a good boy.
The first puppy born we are calling Panic Button. He really is my cuddly baby, and he is the one that's going to break my heart when he goes.
So maybe you might be going up north. Maybe. What you doing, Betsy?
Second puppy is now going to be called Betsy. She's the biggest puppy, actually. She's Miss Greedy. She's the one I have to watch. She will eat everybody else's food. She puts on weight at a ridiculous rate. So she's going to have a lovely time on a farm. Puppy number 3 is going to be called Arthur. He was the puppy that cried every time Betty left the whelping box. So I'm quite happy he's staying locally. His new family are coming in regularly so that he can get to know them, so that when he leaves, it hopefully won't be so traumatic. He won't be going to strangers, it'll be people that he knows.
Staying really close to home so we can keep my eye on you.
Puppy number 4 is one of the smaller puppies again. She's a girl. We're calling her Little Black Ear. She's very cute, she's very pretty. She's the real feisty one, and she's a lot of trouble.
Yeah, you're staying with me.
Last and definitely not least is number 5, who is going to be called Alice and is staying right here with us.
Come on, don't give up.
Alice is the pup which gave Scott and Claire such a scare as she was being born.
Go on, 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 go on. Oh!
Okay. So give me that towel really quickly.
Yep.
This puppy is really compromised, and I'm just really worried that it is not going to come out alive.
Oh.
Hey, there's breath.
Oh.
Okay, we've got a heartbeat.
Jesus. Oh my God. She's really cuddly, she's quite gentle, and she'll play with the others, but then she knows when it's time she wants to withdraw and she'll just go quietly and sleep on her own, and she's affectionate and she's just lovely.
Here, stick this stuff in your mouth, not my toe. There we are, get that, look. You get that.
Alice's brothers and sisters will be heading to their new homes over the next few weeks.
I'm going to be sad. It's going to be so quiet in here. I've got Alice to raise, but yeah, it's going to be really quiet. But they all need homes. Every dog needs a home that's going to look after them. They can't all stay here forever. And it's great to see them being so strong and healthy. And we got there. Nobody keeled over and died from getting cold or not having a feed or getting some strange disease that we didn't know what it was. So yeah, we made it.
On the Isle of Wight, Scott's next job is on some Australian animals he's very familiar with.
When I was invited to the Isle of Wight to help with tiger surgery, I never expected to see some wallabies. Who would have thought it? But now these expats apparently need my help, so I'm very much looking forward to meeting them.
Scott's at Tapnell Farm, where he's met up with animal handler Kimmy.
It's quite the impressive enclosure for the convicts then.
Yeah, keeping them safely in where they should be.
Yeah. So they're quite good escapologists, are they?
They're very good. They've worked it all out now.
Well, they're Aussie. They're very intelligent.
Here we are. There we go, safely in.
These are all Bennett's wallabies, and Scott's been asked to come and worm them.
So this is Katie, our keeper.
Hi, Scott.
Katie.
Nice to meet you.
Nice to meet you. Good to see you.
Wallabies.
Wow.
I'd like to introduce you to the marvellous mob that we have here.
Hello. Hello. Or should I say, g'day, mate? How's it
G'day,
going?
mate. They won't be saying it back, I think.
Me? All right. Well, I suppose then we should probably start with the biggest one whilst we're full of energy.
This is Juice. This is Juice, our big boy here.
Hello, champ. Remember, we're on the same team here. Yeah?
He's puffing his chest up for you.
He is, isn't he?
He's, you what, mate?
He's sizing me up.
Yeah.
Oh. Wow. Okay.
He doesn't like you already. I've got some other recruits that we need to help us today. So I've got Mike and Lucy.
Okay, nice one.
And I have a couple of keepers here
Excellent.
at Tapnell that are going to come give us a hand today.
Good.
There could be kicks coming at all angles, so just be very, very careful.
I'm feeling a little bit more relaxed knowing that I have helpers ready to tackle these wallabies, because although they look really cute and really cuddly, they've got really sharp, quite dangerous claws, and they can kick pretty hard. All right. Yummy. Hey? Yeah, you won't like that, mate.
Nibbles straight in there.
Nibbles.
Nibbles is wormed already.
Yeah, I can tell you that.
She's wormed herself.
Straight in
There
there.
you go.
Only if they're all like nibbles. Only if they're all like nibbles.
Yeah, I feel this is the easy one before the
Yeah.
difficult one. Right, so just grab the base of the tail and try not to get kicked, I suppose.
Yeah, that's basically it.
Okay, I'm going in. Right. Be good, mate. Don't make me look like a fool. Okay, I'm going in. Be good, mate. Don't make me look like a fool.
At Tapnell Farm on the Isle of Wight, Scott is about to worm a mob of wallabies.
There's one important golden rule when you're about to wrangle a wallaby. That's don't get on the receiving end of their really powerful hind limbs and those sharp claws. Go from the back end and grab the tail.
Okay, if you stand up.
You hold the tail.
If you stand up, just because he needs to get his legs.
There we go.
Oh, I don't want to get hit.
There we go. Nice. Good boy. Here's the juice for juice.
Juice with juice.
Hello, mate. Wow.
All right, do you want me to take the blanket off?
Yes,
Yeah.
please. Hello, beautiful boy. Sorry about that, mate. Let me just have a quick look at you whilst you're there. Hey. Some amazing teeth. Hey. A little bit of tartar build up there, haven't you, mate? Hey. So I'm just gonna squeeze this in. I've worked out where there's a gap between his molars. So, all right. Here we go, mate. Good boy.
It's a messy bit.
I know. No one likes taking their medicine, mate.
One, don't let go of the tail. 2, ready, 3, go. And off he goes. He'll be in a bit of a grump now.
So that's the mob leader done, so the rest should be quite plain sailing. But it's always a worry when you're trying to flip a wallaby, even a small one, because they can deliver quite a hefty kick. And their specifically designed, very sharp claws can open up their predators' abdomens, so you need to watch out. And how often generally do you have to worm the
So we worm them every 3 months.
Wow, so every 3 months you have to tackle them.
Yep.
All right, so should we let him up? 3, 2, 1, go.
Good boys.
Right, who's next?
Did you want to do an albino?
Yeah,
Mix
absolutely.
it up?
Yeah.
Jacob is one of our handmaidens
Jacob?
as well.
Okay, he's a very gentle boy, isn't he? No surprise that they're very rare in Australia because they just would get so burnt to a crisp. Yes, better that you're in the UK, mate, isn't it? Eh? Here you go.
Nibbles. Nibbles, come for some more.
But just such an incredible animal. Wow. Eh? Not you, him. Okay, so count to 3, we'll let him up. 3, 2, 1, go.
Here we go. So this is Cinnamon here. She's got a little bit of a chubby face, and that's how we can tell she's Cinnamon.
Yes, but something else she's got a little bit chubby, hasn't she?
she's actually got a droopy pouch at the moment, which means we might have a baby. So a little Joey in her pouch. I know. Got one in there, haven't you, missus?
Wow, that's incredible. Eh?
Good girls. You like sweet potato, don't you? There you go.
Good girl. I know. Okay. Okay. All right. So, there definitely feels like there is a little body in there.
Does it?
Yeah.
Oh, excitement.
There we are. Look, guys, can you see? Look.
Little baby.
Look at that little arm moving. Wow. It's extraordinary.
The Juice is the daddy. He's done a very, very good job this year. All 5 of our ladies fell pregnant, so he's done a very good job. Yeah.
Quite prolific.
Main man,
Is that a nice summer?
Yeah, tell me about it. He's enjoyed himself.
What a special thing to be able to do, to feel a little Joey. We're going to leave your baby alone. You're doing a very good job. All right, so last little bit of worming for you, and this will help your baby as well. There we go. Well done. And good luck growing that baby of yours, hey? Look forward to meeting a Joey very soon. All right, should we let her up? 3, 2, 1, and release.
There you go.
Wow, they're all just so beautiful.
Yeah. Oh, she's forgiven us already.
I've absolutely loved my experience here at Tatnall Farm Park. It feels like I've gone from a little island to an experience of a very big island quite far away. Being around these little Aussie creatures has just really reminded me just how incredibly special Australian wildlife really is, and it's just so wonderful that they're just on my doorstep and I get to give them a little cuddle.
Later that day, Scott's back at the Isle of Wight Zoo to meet up with Charlotte and check up on the 2 coaties.
So here they are, our surgical patients.
Yeah, you wouldn't know that they'd had quite major surgery a few days ago, would you?
No, not at all. I'm just going to check out my own handiwork. It looks very neat.
Doesn't even look sore. And he's forgiven you. What more could you ask for?
Me, eh? How are you, Sattler? You okay, sweetheart? How'd that spay go? Good girl. Hey, you're looking really great, aren't you?
Yeah, it's
I'm
fantastic.
so happy with that suture line.
It must be. Good
It's
job
really
done.
good. Yeah. Now you can live a lovely existence here at the zoo with no concern of brother and sister babies. Oh, you guys are good.
Naughty little animals.
Right, and now to see our girl. I hope her
other
poor mouth
patient.
isn't too sore. Yes.
She seemed really good this morning. So,
Yeah.
again, just as if nothing had happened, really.
They're so tough, aren't they?
Tough. Make us feel complete wimps.
Yeah. Before he heads back to London, Scott has one last patient to see.
Hello.
Hello, baby.
How are you doing?
Good morning.
How are you doing?
How are you? Oh, baby girl. How are you?
Still a bit of leftover blood.
Yeah, but the breath smells so much better already. Hey, how was that?
Good
Was that
girl.
horrible dentist mean to you, was he? No worse for wear this morning, is she?
No.
Hey?
But she's really hungry because she's been starved down over a few days. So I think we probably better give her
Feed her,
something.
put her out of her misery. Do you want to have some food, sweetheart? You earned it, haven't you? What's Mummy got for you?
See, you first, babe.
There you go. I'm really happy with the way that Aisha's surgery went. It was really challenging, but we got to remove all the teeth that we needed to at the same time as ironing out some of her old lady issues.
Gonna say goodbye to me? Bye-bye,
Good
gorgeous.
girl.
Bye-bye.
No.
Yes, I love
That's
you
a
too.
nice goodbye, Aishi.
Yes.
We'll put her on some anti-inflammatories to help to manage her arthritis, but apart from that, her bloods have come back really good, so Charlotte can rest easy knowing that she's got a very healthy old girl. Charlotte, it's been such an incredible opportunity. Thank you so much for letting
Thanks
me
for being a part of it.
be involved. And what an incredible team we assembled, and we got a great outcome. A happy girl who's got a healthy mouth again, and hopefully we'll live here for a lot longer with you. Fingers crossed.
Fingers crossed. Paws crossed.
Bye, baby. Love you.
As always, I've absolutely loved my time here at the Isle of Wight, and to be able to work with these majestic creatures and the fantastic Charlotte is always a complete privilege. So I do hope it's not too long before I'll be back visiting again.
Look at him.
At the end of a busy week, Scott's back in Richmond, in time for an important checkup on a very special pup.
Oh my God. Who's that? Hello. Say hello. This is Elvis.
Clinic regulars Karina and Gaz have just adopted a new puppy, 9-week-old miniature dachshund, Elvis.
I can't believe this. He is gorgeous.
And he's quickly winning over Maz and Kirsty.
When I first saw Elvis, I cried the first time I held him. It just felt so nice to have that love. So yeah, it was perfect. It was lovely.
Elvis. Elvis, I'm Mama.
Hello there. Hear all the commotion?
Who's that? Who's that?
Hello.
Look.
Look how tiny he looks.
Oh my goodness.
Who's that?
Elvis.
Yes.
Of course. He's nothing but a hound dog. Is he crying? Is he crying all the time?
All the time.
Is he? Should we go in the consult room? Check you over. Come on. Come on. Come on. Let's bring your proud parents. Come on. That's it. It's so great to see you guys again, and absolutely gorgeous to see this little fella. But Elvis, you've got some big shoes to fill.
Yeah,
definitely, yeah.
Absolutely.
Come on. Come on.
Karina and Gaz's first puppy was French bulldog Vince, who passed away with a rare muscular disorder.
Oh, good boy.
Vince was a heartbreaking case. To be diagnosed with muscular dystrophy, a wasting disease. Unfortunately, it is going to be weeks, I think.
Okay.
It's such a heartbreaking thing to go through. And I must say, I absolutely love out of place possession.
Yes.
Look, for Elvis, look, this is your big brother's footprint.
Is that?
So he just touched with his beautiful soul.
Oh, But we wouldn't have been
definitely.
able to do it without you guys.
Well, exactly, yeah.
At all.
I think the relationship's
Honestly,
Yeah.
if we-
Well, it's not very often that, through such severe adversity, like we've all become friends.
I know, it's so
Yeah,
lovely. That's why we were so excited
Yeah.
to bring this one in to show you all.
It's like showing
I
off
think
to a
more
member
than
of the
my
family.
family. I was like, right, we're going. Yeah, got a new little addition, putting smiles back on our faces again, which is nice.
Okay, well, should we have a little look at you and make sure that you are perfectly formed in all ways, hey? Not just super handsome.
But this is far more than a social visit. After the heartache they went through with Vince, Karina and Gaz are anxious to make sure that little Elvis is healthy.
His teeth are lovely. It's great. Everything sounds perfect. Yeah.
Oh, yay.
Nothing.
Well done, Elvis.
Oh, that's brilliant.
Some growing to do though, mate.
Yeah.
They're not replacing Vince. They're just moving on and giving another dog a loving home. Elvis is a very, very lucky boy.
Oh, you're wonderful.
Take care.
Thank you so
Bye.
much. God bless.
All the
Thank
best.
you.
Take care. Enjoy.
Bye.
Bye, guys.
Bye, mate.
See ya.